2, or excuse me, is 20 up 2 from the last report. I think we are noted now as having significant spread.
We're at 22 actually today.
Oh, excuse me. Then I'm behind. 22, so we're up a bit, and we're now at significant spread, community spread. Other than that, I haven't heard a lot. I believe we have a couple people. It was announced, I believe, in our health board or health COVID-19 task force that we have had some hospitalization. I don't know if anyone else wants to add anything to that. So just remaining vigilant. I think our recommendation to the City Commission for consideration tonight for their advisory is, it makes that even more important that we continue with that recommendation. I've not heard much on that advisory. We are ready to roll out, should the commission support that this evening, some PSAs. Brad's working on a video. I know, Dr. Milroy, you've done some PSAs as well, so we're ready to roll those things out to the public should this advisory get support from the commission this evening. Ross, do you want to maybe walk through what that is so people that are listening, because I know we have a number of people listening on YouTube, can understand what is included in that advisory? You got to turn on your mic though, Ross.
Be happy to walk everybody through that. Just give me a moment to pull it up here. And I did just email this board an updated copy of that resolution that includes statistics current through today. That's been provided to Colleen. She understands that's the version that's going to be presented for signing tonight if the commission approves it. The resolution reads like a binding directive. However, it is advisory in nature. This is sort of a best practice that we are encouraging the community to abide by in order to limit or halt the further spread of this COVID-19 virus. The first section is a stay-at-home order. It says all residents of the city of Yankton are directed to remain in their homes except for solitary and/or household outdoor activities for the promotion of physical and emotional well-being, and activities related to the provision of only essential commodities and services. And there's about 7 subparts that go with this. The first is residents shall limit visits to grocery and retail stores to once per week or use delivery or pickup services. 2, when it is necessary for residents to visit grocery and/or retail stores, households shall choose a designated shopper to do the shopping for the entire household in order to reduce the number of people in the stores. Shoppers shall remember to remain at least 6 feet away from others in the store. 3, whenever possible, residents shall avoid taking any children still living at home with them on any essential shopping trips. 4, residents returning from extended trips or spending the winter in warmer climates shall self-quarantine for 14 days upon their return. 5, residents should support local businesses that promote social distancing and demonstrate compliance with the CDC guidelines. 6, residents are encouraged to participate in organized religious activities only via remote or drive-in options as available. And 7, even while adhering to the 10-person gathering limitation imposed by Ordinance 1033, residents are directed not to participate in voluntary in-person gatherings of any size outside of their immediate household. Section 2 relates to healthcare. Residents of the city shall call ahead to healthcare providers if feeling sick. And there's 2 portions or 2 parts associated with that directive. First, residents may still attend routine medical appointments, but shall follow the guidance of their medical providers and always call ahead if feeling sick. And the second part of that is residents may continue to go to the pharmacy to pick up medications, but shall use drive-through or delivery services whenever possible. As a reminder to the public, we had a positive COVID-19 case inside a pharmacy locally here. So that's quite important to minimize your contact with the staff in those locations. Section 3 is safe practices. We're directing that residents of the city of Yankton continue to practice good respiratory hygiene, cover coughs and sneezes with a tissue, or use the inside of their elbow, wash hands often, disinfect surfaces frequently, avoid touching their face, and strictly adhere to social distancing guidelines. Additionally, consistent with current CDC guidance, residents over the age of 2 who do not have trouble breathing should wear face coverings, i.e. a face mask entirely covering the mouth and nose, when they are in public areas outside of their homes, such as by way of example, but not limitation, the grocery store or medical clinic. And I believe we revised that phrase last time to reference interactions with the public as opposed to just being outside in public locations. Section 4, mental and emotional health. Residents of the city of Yankton should be mindful of their mental health. That includes 3 subparts. Residents may continue to engage in outdoor activities. I'm sorry, I gotta back up. Residents of the city of Yankton should be mindful of their mental health. 3 subparts. Residents may continue to engage in outdoor activity, such as by way of example and not limitation, walking, hiking, running, or biking, provided that individuals strictly comply with social distancing and all other measures as advised by the CDC. 2, residents should be good neighbors to those around them and help others if able, keeping in mind that it remains critical to use safe practices as recommended by the CDC. And 3, residents should support local businesses to the greatest extent possible while strictly abiding by CDC guidelines and this resolution. Section 5, directions for businesses. Businesses not required to close or otherwise bound by the 10-person gathering limitations set forth in ordinance number 1033 shall, whenever possible, limit their patron and employee occupancy to no more than 20% of their posted occupancy, and shall institute and enforce a safe social distancing strategy for patrons and employees inside the place of business and for patrons and employees waiting to enter outside the place of business. That still line up with everybody's recommendation to the city commission.
That's for me, Ross.
Very good.
I think it sounds good.
I would like to convey to this board, I did get some feedback. This was shared with some commissioners that had asked for a copy of it, and I did get some feedback that at least one of the commissioners felt uncomfortable that a stay-at-home directive was coming from the city government level. So based on that feedback, I did want this board to be aware it may not be a unanimous decision if it is passed by the commission today. I don't necessarily know that that matters. I mean, this doesn't have the legal force of law. There's no criminal penalty for violation, and it can be passed by a plurality of a quorum of the commission. But I did want you guys to be in the loop on that.
Yeah, I had the same feedback, Ross. Well, if there's nothing else on that, I guess I just wanted to lift up, again, I've had some communication over the weekend from hairstylists and cosmetologist type folks. Again, raising the questions about being open. Concern seems to have shifted a little bit now to be, well, because there's hairstylists still open in Sioux Falls or other communities, our people are just going there, so why not let us be open type questions. One comment of support, I guess, from a stylist who thinks we are doing the right thing and the dates are appropriate. And then again, questions about tanning salons. So just a query, I guess, to the health board members and ex officios if we still think we're doing the right thing, since our numbers are, well, they're still growing, but they're slow to move up.
And I think we've seen in Sioux Falls how quickly the situation can change if you don't have measures. It's true, Sioux Falls has not taken as strict of measures as we have, and I like to think that the fact that we've done that has contributed to our numbers not growing as quickly.
Yes, I would agree with that. And also, I think that at this time, it might, we had talked about it a little bit before about starting to make a plan for how we would reopen. I guess my concern is I would prefer that we not sort of do a piecemeal, like, oh, yeah, maybe you, no, not you, yeah, you. It's going to be a mess. So I think that at this point in time, I mean, we're all hoping that we can reopen businesses as soon as possible, obviously. But maybe to start getting an idea of what that would look like and what might be some of the first businesses that would be open, so we would know what stages we would go through, so that when that time arises, we do it in an orderly fashion and not piecemeal. That's what I would say. So if we say, oh yeah, maybe that business can, you can't, I just see that being very confusing and just won't work very well.
Yeah, to me, it might be also a matter of not which businesses can be open, but maybe how the businesses can open. So I'm trying to get a hold of some plans from other places in the country, as well as thoughts from other cities in South Dakota as what people are thinking is going to be their plan. I'd like to use our timeline a little bit to our advantage so we can look at some best practices. And I think because we're a little slower than some of the other parts of the country, we might have some advantages there, but I think we have some time yet to make that plan.
I think the really difficult thing in having the discussion, I'm not just talking about hairstylists, but for whatever business may be open in another community, that's an hour plus away, as compared to what's open in Yankton. You would just hope that, people would feel a strong desire to do the right thing and not be taking trips like that at this point in time. My daughter's, in that city, and I would have loved to have spent Easter with her, but we made a conscious decision this weekend to, have Easter via technology as opposed to hanging out together, just because of this. So, by all means, if people are making decisions like that regarding family, I would hope they'd make the same decision regarding some business that they choose to leave town to visit.
I think there's some people that go get their hair done in Sioux Falls no matter what, whether we have COVID or not have COVID. And I kind of, maybe I'm an optimist, but I think that might be a very small percent of the population. I think overall the community has been very responsible, and I think that they really want to be safe. So I would be certainly hopeful that that's a very maybe visible but small minority.
As far as when it comes time to reopen, I think we're going to start seeing a real national direction towards that, because getting the virus under control is such a national effort. It's not something we can control at the city level or really even the state level, because what we need, what I keep hearing from health experts, is you need widespread rapid testing. You need to be able to isolate people and separate them as soon as you know. And we're just nowhere near that yet. Other countries have figured this out. We have not, and that's going to be the biggest hindrance, unless we're just going to open things up and let the virus run loose. That's the reality I'm seeing, unfortunately.
So anyone else have any comments on that or anything else they'd like to bring up to the health board before our meeting on Thursday, or things you'd like staff to look into? Okay, that's okay with me to adjourn a little bit earlier than normal. So if anybody has anything else they want to bring up, otherwise we'll look for a motion.
I'll make a motion to adjourn.
I will
Motion.
second.
Motion and a second to adjourn. All in favor signify by saying aye.
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 Okay, opposed, same sign. City Commission meeting is this evening. And our meeting with the health board, our next meeting will be this Thursday. That I believe is the 16th at 2 p.m.
Yep.
Okay, thanks everybody.
Okay, thanks.
Take care.